scared, lonely, confused. These are some of the emotions that I went through when I went through my ordeal. Let me start from the beginning. My name is Sithabiso. I'm a medical doctor. I studied in Uganda at Mbarara University of Science and Technology. I would say that I thought I knew everything about healthcare until I gave birth. I delivered my baby boy in September 2018. It was a relatively good pregnancy. I didn't have a lot of problems. I should tell you that I had fibroids 3 years prior, of which I was operated, and they removed the fibroids. And then I had my first pregnancy of my firstborn, little Anashe. When Anashe was 1.5 years, I fell pregnant, my second baby. And it was going to be a cesarean section as well. So everything was going well. I was admitted on the Saturday. I remember the night very clearly. On Sunday morning, we're going to go into elective cesarean. But at midnight, my waters broke. Baby was coming early and I had started my labor. So I was rushed in for an emergency cesarean section at around 4 a.m. in the morning. That was fine. It was a few hours early, but we were well prepared. And what better place for it to happen than in the hospital? Little did I know this was going to be one of the most complicated deliveries that I had ever heard of. So, complication number 1, I had adhesions all over. That simply means that my uterus was stuck to my intestines so badly. The surgeons had to meticulously cut away and try and separate these before they could remove the baby. Safely, the baby came out and he was fine, but they still had adhesions to take care of. And then what happened, because there were so many adhesions, they ended up cutting my small intestine by mistake. It's not uncommon, it happens all the time. But they had to call in another doctor who was going to take care of that problem. The other problem came when they found a funny mass on the left side. Didn't look like anything they ever saw, they didn't know what it was, but they removed it and they sent it to the pathology who was going to do some tests to find out what it was. After all was said and done, I had 5 surgeries. The cesarean section, the adhesion release, the small gut was cut and they had to repair that, and the tubal ligation, cutting my tubes, and appendicitis. That's what the mass was. So 5 surgeries in one. I was recovering and I thought everything was going well until I stopped passing poo. This is what they call paralytic ileus. Basically, because they'd fiddled around with my intestines a lot, my intestines stopped moving. And now I had gas. And no stool because I hadn't eaten, but I had lots of gas and nothing was passing. So my abdomen became a drum, getting bigger and bigger and more painful by the day. They couldn't give me laxatives because of my small gut that had been operated. On top of that, I developed anemia. My blood levels were very low. And on the 5th day, I got a fever. No one knew where this fever was coming from. All I knew is I wanted to go home. I cried and I cried. He put me on IV antibiotics and seemingly the fever went away. Anyway, long story short, 2 weeks later, I was home. I was happy and I was with my baby. But my complications were just beginning. I had a constant mild fever. My whole abdomen would be hot and cold, hot and cold. I didn't know if this was normal. I wasn't sure what to think. When I went for a review with the gynecologist, he looked at my tonsils and he said, "Oh, you've got tonsillitis, it's viral, don't worry about it, it'll go away." So I didn't worry more about it. He sent me to the surgeon who had done my gut repair, and the surgeon said, "Well, your heart is beating a little fast, maybe you've got an infection, let's do some tests." They did tests, didn't show anything, I went home. It wasn't getting better. I went back to the doctor The doctor said, okay, maybe there's something else going on. This was 3 weeks later. Then he sent me to get a CT scan done of the abdomen. Lo and behold, I had developed pelvic abscess. What this is a ball of fluid, which is pus. It's like a sack of pus sitting in my uterus, sitting where that appendix was situated. Basically, I'd had an infection which had not been managed well. That time I had a fever, it was back, and it was now an abscess. So I was then sent to what they call an interventional radiologist, who's a doctor who looks at who treats using tubes and using scans. So they didn't want to go back and open me up. They just wanted to use a scan to see and then drain the fluid, drain that pus. So I was back in hospital, I was admitted. Remember, I still have a baby who wants to be fed every 3 hours. I was back in hospital and I had yet another procedure done, which is the drainage of this fluid, which was pus from my pelvis. This procedure took about 3 days and I was discharged to go home. I thought everything was over and I was on the road to recovery. Little did I know the worst was yet to come. I was at home trying to recover, blaming myself of laziness because everything was so hard. I was still having mild fever, my abdomen hurt, everything hurt. And here I was having to breastfeed and cuddle and look after a restless baby. It was exactly 2 months after I delivered when I ended up in the emergency rooms. I was attacked in the morning by acute, severe abdominal pain. It was different from any other pain I'd felt throughout after my pregnancy. I remember telling my little daughter to give me a moment because I felt I needed an ambulance. I didn't know what it was, but I knew it was urgent. I ended up in casualty in a private hospital and I was screaming in pain, begging the nurses to give me pethidine, but they couldn't because they were not allowed to sign for it. The doctor was 10 minutes late and it was 10 of the longest minutes of my life. I thought that this is how it feels to die. And I was all alone. I was all confused and I didn't know what was happening. I ended up in theater 24 hours later, having had 3 pints of blood transfused, and they were performing on me yet another surgery. I had had my pelvic abscess recurred, it had come back, and this time with the vengeance. It had burst and I had pus all over my abdomen. It had reached my lungs, I had pus in my lungs, I had pus all over, and my uterus and my ovaries were severely infected. So much so that they were going to have to remove them. Not only that, but I had difficulty breathing because of the lung issue. So I was put into HDU after the surgery and I was having oxygen administered to me and I was basically fighting for my life. This was a maternal complication I had not expected. There was nothing in my history which made me think I deserved to go through this or I'd missed appointments or something had led me to this point. It was just another complication of maternal health. And I, as a health worker, just like anyone else, and anyone can go through these complications. I was lucky that I had health services nearby. I was lucky that I had the knowledge to react fast and to get the help as soon as I could. But there are women out there who are not as lucky, and we need to do our best to make sure that we save every single mother. No woman deserves to die giving birth. To the community, mothers preparing to give birth, make sure you attend all your antenatal care clinics. Make sure you go for all your postnatal care clinics. If you feel anything is wrong, if something is off, don't hesitate. Go to your doctor, go to the nurse, make sure it's addressed. To healthcare workers, take all the concerns of your patients seriously, even the ones that don't seem so serious. Sometimes it's the little things that end up as complications. And to the researchers, let us research on all these things. I had appendicitis in pregnancy. Who gets that? Nobody. Somebody got it, and it was me. We need to do a lot more research, especially in maternal health. Sometimes those ailments, such as appendicitis in pregnancy, may end up into very serious complications. Let us do more for our women to find out what is causing these problems. Let us do more to equip our health workers to know when to act and how to act.